Hello everyone, we are now going to study the facial artery. And as you probably know, the facial artery is one of the branches of the external carotid artery. So if you look at an enlarged view of this picture, you can see here that the facial artery has come out of the external carotid artery. It's the anterior branch of the external carotid artery, and it has arisen somewhat above the level of the greater cornu of the hyoid bone. And the facial artery has a part in the neck, which is the cervical branch, and it has a part in the face, which is the facial branch. So the cervical part, we will look at the cervical part first. You can see that this cervical part extends from its origin to the anterior border of the masseter, and then the facial part undergoes a tortuous course across the face, close to the lateral angle of the mouth and close to the medial angle of the eye, and it ends somewhere here at the medial angle of the eye. And this facial part of the facial artery is quite tortuous. This tortuosity is probably to give some leeway for the opening of the jaw, for the movement of the mandible, and for the movements of deglutition and so on. Now, if we look at the cervical part of the facial artery, the first branch that we will find here is a branch which is called the ascending palatine artery. Now, you cannot see the ascending palatine artery in this picture because it is passing deep to the mandible. It is going over the superior constrictor muscle of the pharynx to the base of the skull, and there is a gap between the superior constrictor and the base of the skull somewhere here deep inside, and through that gap this ascending palatine branch of the facial artery will drop inside the pharynx, and it will go and supply the soft palate, and there it will anastomose with its fellow of the opposite side and with the other palatine branches, that is the greater and lesser palatine branch coming from the maxillary artery, and it gives some pharyngeal branches to the auditory tube that will anastomose with the ascending pharyngeal artery also coming from the external carotid artery. Now, apart from the ascending palatine artery, in the neck the facial artery gives off the tonsillar branch. The tonsillar branch also passes along the superior constrictor, but somewhere here it pierces the superior constrictor and goes to the tonsil and supplies the tonsil and other tissues around the tonsil. Then when the cervical part of the facial artery goes under the mandible, it passes deep to the mandible somewhere here, and it winds around the submandibular gland below and inside deep to the mandible. Somewhere here it will wind over the submandibular gland, and when it winds over the submandibular gland, it goes over its posterior surface, and then it again comes here into this inferior border. So when it winds over the submandibular gland, there it gives short branches to the submandibular gland, and these are called the glandular branches. And then when it is just about to enter the face at the anterior border of the masseter, at that point it gives off this submental branch, and this submental branch passes along into the submental triangle from the digastric triangle, and it supplies the chin and the tissues of the lower lip, and in supplying the tissues of the lower lip it will anastomose with the mylohyoid artery, which is a branch of the inferior alveolar artery, and with the submental artery over here. So this is so much about the cervical part of the facial artery. Now at the anterior border of the masseter, where the facial artery enters the face, here by clenching the jaw and making the masseter prominent just at the anterior edge of the masseter, you can feel the pulsation of the facial artery. Now just behind the facial artery you also have the facial vein. The facial vein pursues a rather straight course. It is not so tortuous, and although they are separated in the face, they come together at this point at the anterior border of the masseter. The two vessels come together at the anterior border of the masseter, and then the facial artery is continuing on its tortuous course. And of the important named branches, you come across this inferior labial artery. So you can make out the muscle here going to this fibromuscular node at the corner of the oral fissure. This is called the modulus, and under the depressor anguli oris you can see the submental branch, the inferior labial branch. Inferior labial branch of the facial artery is going deep into the lower lip, and in the lower lip it actually lies between the mucous membrane and the muscle bulk of the orbicularis oris. And then again we go along the facial artery. The facial artery has gone deep to the zygomaticus major, and again you can find that it has gone deep to the levator labii superioris, and it has given a superior labial branch. Now this superior labial branch supplies the upper lip, and again it is between the mucous membrane and the muscle bulk of the orbicularis oris. Not only that, it gives off a septal branch to the nose and an alar branch to the nose. Beyond that, the facial artery is continuous, going along the side of the nose, over the levator labii superioris alic nasi, going on to the medial angle of the eye, and in this course it gives off another branch, the lateral nasal branch, which supplies the dorsum and the ala of the nose. And in reaching the medial angle of the eye or the inner canthus of the eye, it anastomoses with the dorsal nasal branch of the ophthalmic artery, which is again a part of the internal carotid artery. Now, apart from the facial artery proper, you have additional supply from this transverse facial branch of the temporal artery, and here you can make out little bit of supply from the supraorbital supratrochlear arteries. Somewhere here you have the infraorbital artery. Here you have the mental artery. Actually, these small arteries are all branches accompanying the sensory nerves coming from the trigeminal nerve. So a number of sensory branches are supplying the face, and these sensory nerves all have accompanying small arterial branches, and they are anastomosing with this facial artery. Again, the facial arteries of the two sides are connected to each other. Facial artery, through the facial artery, the internal carotid and external carotid communicate with each other, and you have already seen that there are multiple anastomoses in the cervical branch of the facial artery. So these are the important points that you have to keep in mind about the facial artery. That's all for this part of the video. Thank you.